infertility per se, if we see the journey has been very long. 1978, since the first birth of the test tube baby way back 1978 in London, UK. Way back since then to now, 4 decades, and there's immense research, there's immense development, and so is the incidence of fertility also. The infertility incidence is going up, and India is nowhere lacking behind in terms of the incidence of infertility. With the growing population, I think the incidence of infertility is also going up there. I think 10 years back, we probably were in every 8 or 10 couples, it used to be one couple having some issue with conception, and now I think it's come to 5 or 6 couple. Amongst this, at least one is coming across with infertility issue. So there is a growing incidence. The burden on the community and society is going up, and the good thing or the best thing is, the taboo about infertility is now going off the society. People are open to talk about it. People are open with the concept of getting some medical help than going, getting these religious helps or getting into those little traditional beliefs. I think people are coming out. They know that there could be medical reasons, and when they come and get help timed points, there could be a solution for them to get out of this at the earliest. So as we were discussing that the incidence of infertility is on a rise in India. In fact, if you really look at the demographics and epidemiological studies, if the cardiac ailments and the cancer oncology incidence is going up, so is the fertility. I think there is a growing need, and everybody knows about this. So now what has happened is the need for treatments have gone up. People wanting to get treatments has gone up. And the scenario in the country is changed, where we see people getting trained. We've got state-of-art facilities. We are nowhere less than the Western world when it comes about the latest advancements. I think we are on par with the United States, Australia, or UK or Europe, where we've always had this thing that the West always performs the best. In fact, I was trained at one of the best universities in Australia, which is Monash University, and I always had this concept and conception in my mind that Australians did wonderful job with fertility, but when I came back to India, I think we were nowhere less, and that's what holds me back in this country. So the technology, the outreach, everything has gone up, but what we really need is standardization and regularization of this practice, because there isn't a way of policing the way we are practicing. When it comes to fertility, I think there is a lot of sentiments, a lot of social values that also matter a lot. And all of us agree on the fact that infertility is not a disease. We are not really treating a specific disease here. The specific outcome is not there. The woman and the couple are going through enormous psychological and sometimes physical and financial stress here. So there are quite a few social challenges which needs to be addressed. I think primarily the first one is the finance. I think the technology is improved, we are able to give better success, but it's coming at a huge cost. I think that is the biggest challenge at the current point. And second, transparency in the treatments what we are offering. There are times where the couple has gone through the whole segment of treatments, and at the end they're not really made to understand what has been done, why things haven't worked. There isn't much of information or paperwork given to them, where if they go to another doctor, we absolutely have no idea as to what has been done. So the need of the hour is regulation of this practice, which helps us get better transparency, which helps us cap the treatments to an extent, and of course being scientific and ethical, because there are certain examples we could quote. Safety of pregnancy is important. Yes, conceiving is a priority. People come with a lot of hope, but that should not be at the cost of the woman's health. So one of the commonest practices which is probably overdone is to put back more embryos, because that would translate into a better pregnancy rates. So people have this practice of putting 3, 4, 5 embryos at times, and this puts at an increased risk of multiple pregnancies, which is a twin or a triplet pregnancy, which has got a lot of complications. So that is something that we can control if we are more aware, and there is a policy that sets in and says you only can be putting in 1 or at the max a second embryo. So if I am going to go and tell my fellow clinic, or let's say in a conference we're telling this, it's good to hear. All of us as medical practitioners know that that's a complication, but in reality, in practice, there are a lot of times we're pressurized by the society, the couple wanting it. We sometimes get carried away with their journey because fertility is a long journey with a couple. So this is where regulation really is the need of the hour, where we could probably sit down and say, okay, this is what the regulation says, I can't be going over and above this, and that probably works in the best interest of the patient and the future child. Well, in terms of infrastructure, as in people who are coming and establishing these units, I think they're putting in the best technology. Since we are all like clinics which have started up in the last 10 years, I think technology is something that we've always looked at and implemented it. I think majority of the clinics, I think you have the best of state-of-art equipment in there. The training is there, but how best to put it at practice, how to get the best outcome with this technology and the knowledge and know-how we have with all that state-of-art facilities is probably that's the segment which needs some kind of regulation, further fine-tuning, because at the end what we deliver is what it matters. I might have the best technology sitting in my lab, and I might not really be using it the way it should be used. Probably let's take an example. I've got an Apple iPhone with me. If I'm not really used to this technology, I don't know how to get the best with that technology. It could just be another phone where I'm just receiving phone calls and sending text messages. So similar would be the concept with the clinics. I think the technology, the equipment, state-of-art facilities are there, but are we really streamlining it and practicing it the way it should be? I think that is where the Western world is quite different. I think the practice is more protocol oriented. They stick to a set guidelines and regulations, and they never go beyond it. And unfortunately, for various reasons, we do not have anything specific to fertility in the country, but for the guidelines that the Medical Council of India has given us, which are the basic code of ethics for medical practice, but nothing specific to the fertility industry. And I think that's where we really have to work hard to get in a system so that we could work towards the betterment of the future generation. We're nowhere less. Initially it was all about understanding of how to do the basic procedures, techniques like, it could be IVF or ICSI, which are the techniques which are helping us create the embryos. It's all about giving better success. In the early 80s, I think the success was 10 or 20%. We said, what do we do to get the best outcome? And then, there was improvement in the way we could culture the embryos. So that is where there is something called an incubator, which is like the woman's uterus. There's immense innovations and developments and research and development that's happened in the incubator and the whole culture segment. It has grown to a point where we now have these latest incubators fitted with automated cameras, which is taking images every minute. So, I always wondered why, as a doctor, I did not have a work from home option. Now that's no more an issue. It's in reality, it is possible for an embryologist. So you just come, you do the process of ICSI or IVF, where you've mixed the egg and sperm. You leave it in the incubator, you just go home, and the images are constantly coming on your laptop, and you just see what's happening. And on the day 5, you just tell this is the best embryo, probably that's got the best pregnancy outcome, and a junior or one of your colleague in the lab is just picking and putting that back. That's really an amazing technology, and I think there are quite a few clinics in India who actually have implemented this. So in terms of technology, if you take every segment, if you take about the female management or the male management or the embryo per se, there's a lot that's gone, and I think we see that being practiced in the major clinics of the country. So we are nowhere less, but here is the major question that comes. There are times where the technology has just been introduced and we're directly taking it onto the patients. Are we right in doing that? It takes years sometimes to realize that what we've invented is actually right, and it's translating into the right practice, because the health of the mother and child is our utmost priority in whatever we're trying to do here. And a newer technology takes it a while to get into practice. So in European countries or these other Western world, I think the way they implement a newer technology, there is a set standardized way of doing it. And in India, we don't have anything. I'm free to bring in a newer technology, counsel a patient, get their consent, and just get started. And with the background of their understanding of the patients, they could just think it's another piece of paper and they give us a consent. But is that in future creating any kind of a problem? We don't really know that. So a very good example for that is ICSI, that's called intracytoplasmic sperm injection, which was a breakthrough revolution in the way we could have mixed the eggs and sperms. So for a severe male factor infertility, which is on a rise off late, there's no way, if ICSI was not in the field, that they would have conceived. Worldwide, everybody is practicing ICSI. It's probably one of the commonest ways of offering IVF, but we really don't know that's going to bring about any kind of issues in the future. The safety of it, the long-term health aspects of the child born out of an ICSI is still a matter of debate. A lot of research is going, and recently the World Congress was pointing out that the boys born out of these ICSI, the male gender would probably have some kind of issues, and they could be infertile as well. It's just a hypothesis, long way still to go. But the point I wanted to make there was, it's nice, the technology, scientists are coming up with newer technologies. A country like India is open to embrace the newer technology and give the best to our patients. But I think that should be taken with a little caution there, because not everything is safe, and we are answerable to the future generation here. Well, I think it's a wonderful initiative by the Economic Times with this Fertility Conclave, where I think they're bringing about a sense of awareness. We go to conferences, I think we are keeping ourselves abreast with the latest developments in technology, but as we were talking, there are a lot of social challenges that as a doctor, as an embryologist, we face, but equally I think the patients who are coming are also facing a lot of social challenges. I think such fertility conclaves where they're bringing across the medical fraternity, we've got the entrepreneurs, we've got the people from the industry, and I think we are the key people who can be the game changers. So it's always it's a wonderful initiative where all of us are coming across, putting across our thought process. I think it's high time we really just put that little regulation bit. I think India would really go up there. We are nowhere less in terms of the work we do, the success we offer, the technology we've got on, and the amazing bit is the skill what we have in the Indian doctors is amazing. But since we lack this bit of regulation and standardization in the practice, I don't think we really looked up to, and I don't think we deserve that. So I'm really happy and thankful to Economic Times for these wonderful platforms of fertility conclaves that are happening in every city, which actually are leaving us with that thought, encouraging us to do our bit in a way to bring about betterment and ensure the future is all safe. And as a citizen, I think we deserve to be doing that. Well, I think I would be looking more at the innovations that they're bringing in. As to know, yes, as a doctor, I know the innovation is available. I've seen how to do it. But how the entrepreneurs or the other people wanting to actually get this percolate down, because I do not want a technology which is only available for a particular segment or class of the community. I think you don't treat a patient based on their, you can't be discriminating them based on their class or creed or their economical background. Fertility, if you primarily look, is a lifestyle disorder. There's so much of pollution, so much of stress, so much of other things which are bringing about fertility, whether it's rich or poor, whether it's an IT person or a medical professional. I think everybody's been hit with fertility. So I think we got to be working towards ensuring this technology reaches everybody. And I'm looking forward to get some inputs from the entrepreneurs to see how are they really wanting to plan to get this percolating down to everybody in the society who's needing it.